Welcome to Nasdaq Trade Talks. I'm Jill Malandrino, global markets reporter at Nasdaq. October kicks off Breast Cancer Awareness Month. Joining me is Jennifer Meade, Division President of Breast and Skeletal Health at Nasdaq-listed Hologic. Jen, it's great to see you. Welcome to Trade Talks.
Thank you so much.
And during the month of October, breast health tends to be on top of mind for everyone. How has COVID-19 changed that?
I think COVID-19 has really had a staggering impact on really every facet of our lives across the country and really across the globe. And I'd say that's no different when you think about breast health and breast cancer screening. If you go to the early days of the pandemic, we saw in the months of March and April a dramatic drop-off of volumes of patients going in for their screening exams, particularly as our customers and facilities needed to shut their doors or pull back on some of those elective procedures to make sure that they were focusing resources and energy on fighting the pandemic. The good news is we've seen a consistent and steady increase in those volumes over the course of the last few months. Not quite at normal yet, but definitely to a healthier level. And I think, knowing what we know about early detection and the impact that can have on the overall prognosis for patients and ability to treat, that's good news. We need to keep that trend going.
Give us a high-level overview of what Hologic does and what are some of the innovative solutions the company provides in the fight against breast cancer?
Yeah, Hologic is an innovative medical device company, and we're primarily focused on women's health. And we take great pride in our belief that as an organization, we've done more for women's health across the globe than any other company in existence through all of our different lines of business. We pioneered digital breast tomosynthesis, which is 3D mammography with our Genius 3D exam. And we continue to improve our overall solutions to help screen, detect, diagnose, and treat breast cancer. We focus quite a bit on the entire continuum of care for patients, all the way through that screening and diagnosis through to treatment. And we focus a lot on building a very integrated and seamless flow, which helps in a few different ways. It improves outcomes overall. It finds cancers earlier. It also improves workflow and takes costs out of healthcare for our clinicians.
What are some of the technologies that go into these solutions?
Well, it starts with superior imaging technology. Everything starts with that screening exam. Once you find it, you can move down that continuum. We also focus quite a bit on our Genius AI platform, which is our core artificial intelligence platform. And that does a few different things. It helps aid in advanced cancer detection. It also, again, improves operational efficiencies and workflow for our clinicians. And it's some advanced decision support so that they can be more confident in their diagnosis of cancer. We also focus a lot on comfort. So when we decide what technologies we want to innovate and develop, we get a lot of feedback from clinicians and patients. And we know that one of the primary detractors for women to go get their screening mammogram is the fear of pain or discomfort, right? Anybody who's gone through it can understand that. And so one of our more recent innovations is called the Smart Curve Breast Stabilization System. And what it is essentially a curved paddle that goes on the machine, and it's shaped much more naturally to a woman's breast. And so it provides simply a more comfortable mammogram and experience for patients.
In what areas are you seeing significant improvement with how clinicians provide care?
Well, I'd say the good news is that 3D mammography is now considered the standard of care. And that's really good news because we know it finds more cancers earlier when they're more treatable. We also, really importantly right now, have seen tremendous work done out in the healthcare environment and facilities with customers really putting in protocols to help customers or patients, feel more comfortable coming back and more safe coming back to get care. Again, we know that if they're not going in, getting their routine screening, there's a risk that we're not finding cancers earlier. And so I think all of that tremendous work and best practice sharing that's been done to help those customers figure out those protocols and get patients back is a huge boost overall to healthcare. Yeah.
Let's dive a little bit deeper about those potential implications for women missing their annual breast cancer screenings as a result of the pandemic, or you're trying to integrate your kids' schedule with school, or life is just happening, right? And then what's being done to get women to prioritize their breast health and resume screenings?
Yeah, again, COVID-19 really just made such a huge impact in so many different ways. And I don't think that that's specific to breast cancer screening, right? It really runs the gamut of all preventive care. I think there's a significantly really big impact of not getting back to those routine exams. We've done some patient surveys and insights work to understand sentiment overall. And from our most recent one, about 27% of patients indicated that they were still a little bit nervous or may defer or cancel their screening exam. The National Cancer Institute recently released a statistic that across breast and colorectal cancer, we could see as many as 10,000 additional deaths directly as a result of delayed or deferred screening during the pandemic. As we mentioned earlier on, we know that the earlier you find it, the more treatable it is. And as you said, I'm a working woman with kids. We all know how hard it is to prioritize time for yourself. And I think especially now as we embark on Breast Cancer Awareness Month, it is critically important that women take the time to prioritize their own care and health, take a few minutes to get that exam scheduled and get back on track with your routine care. As the global leaders in this space, we're fully committed to helping get that word out and encourage patients to get back to quote normal, whatever that looks like. And I'm really pleased to be able to partner with our Genius 3D spokeswoman and breast cancer survival, Cheryl Crow, in our Back to Screening campaign. And that is all about getting the word out and reminding women of the importance of getting their routine screening exams.
And with proper preventative care and the solutions now available, can that also help to drive down healthcare costs and provide more accessibility to treatment?
Absolutely. So we've talked about the treatability and the prognosis overall when you find cancer early. It's also significantly less expensive to treat. Those interventions tend to be a little less invasive and less costly overall to the healthcare system. And so 100%, the more routine screening is done, the more you find cancer early, it absolutely takes the cost out of healthcare. And we're also very committed to driving global access to care for women. And we invest quite a bit in that space.
Right. And of course, for Hologic customers, hopefully we're starting to see their businesses recover with the doors reopening.
Yeah, 100%. Like I said, early days in the pandemic, it was on average about a 90% decline we were seeing in volumes, and that has continued to consistently improve, which is great news all around. The other thing I'll say is it's Breast Cancer Awareness Month, and we focus quite a bit on the breast health business. But I'm also tremendously proud of the work our diagnostics division have done. Early on in the pandemic, they developed and released one of what's now the leading COVID test in the country. And so when you think about our customers and healthcare facilities being confident in having patients come back through, get back to some of those elective procedures, that is absolutely a boost there. And I think will continue to be for quite a long time.
Certainly quite encouraging, Jen. Thanks so much for joining us on Trade Talks.
Thank you. Take care.
Thank you. And thanks for joining me. I'm Jill Malandrino, Global Markets Reporter at Nasdaq.